Hi everybody, I'm Steve Miller and I'm going to talk a little bit about how the pelvis can have an influence on hamstring injuries. So if we think about the pelvis, clearly we have your hamstring group that attaches sort of into your ischial tuberosity at the base here. You've got your biceps femur, your semimembranosus and your semitendinosus really. Now they are going to be influenced by the pelvic position, both in a static position and also a dynamic position. So we need to think about what that pelvis is doing, and it's perfectly natural that we have movement in the pelvis. However, if there are myogenic influences on that pelvis that maybe influence the position, if things are overactive, there may be a suboptimal or a less efficient position for that pelvis. So things that can occur, really what we can get is that the whole innominate bone rises up, so the whole thing comes up. Now there's going to be an increased tension, more than likely, in the muscles that sit between the base of that rib cage, all the influential factors of sort of breathing. Things like your QL, your quadratus lumborum are going to become quite tight, your diaphragm may well get affected, and there's going to be an increase, importantly, in the hamstring tension running off there because the whole system has moved upwards in a keflad direction. The other things that can happen is you get an anterior rotation of that pelvis. So again, if we think about the attachment site of the hamstrings, if we go from this neutral position here to then a tilted forward position, it's actually moving relatively away from the distal attachment site. So there's going to be, again, an increase in tautness through that hamstring, which again can leave an athlete a little bit more predisposed to tears and tightness should that occur. The other things that you can get are things like an intrapelvic rotation. So that's where your innominate, rather than sitting square, almost rotates slightly. So therefore what you'll find is there's actually some intrapelvic movement, and then therefore other muscles may well be working harder to neutralize the pelvis. You might find some big compensatory work from the obliques that keep on getting very tight on one side if that occurs. The piriformis might well also become influenced as well. Hope that gives you a little indicator of some of the ways that that pelvis can move. If you want to learn about how to treat them, again, all of that information is in the sort of Grow Physio archive that we have at growphysio.com. So I'll hopefully see you soon and catch you there.